You know, Dr. Lal, every time I have met Dr. Devi Shetty, and I've had occasion to meet him personally, we've had a family equation, and whenever I've met Dr. Devi Shetty, he has always told me about scalability, and he has been obsessed about the need to bring in the human resource aspect to medicine. And we often think, Dr. Shetty, that good medicine means getting good equipment. But medical care means getting the caregivers. And you have been speaking about it. You've written editorials, you've lobbied for it. I think you've been pushing for the cause, and then boom, suddenly, COVID-1, COVID-2 happens, and everyone turns around and says, did we not read the warning signals in time? When Dr. Devi Shetty and others would say, we need more doctors, not less doctors, we need more specializations, we need to loosen the controls, we need to get the students in, we need to get real practitioners in, and suddenly we find a shortage of doctors, and we find doctors who are so stressed. I just wanted to start by asking you on this Doctor's Day, Dr. Devi Shetty, that the human resource problem in the medical field, how can we fix it? How urgently can we fix it? And how urgent is it to fix it today, given what we are facing?
Thanks, Arnab. Thanks a lot for the opportunity. First of all, when the COVID first started, we all thought that it's going to last for a year or maximum 2 years. Then one day there will be a big announcement that COVID has gone and we will all celebrate and live happily ever after.
Yeah.
But unfortunately, COVID is not going to go away. COVID is not going to go away for quite some time, few more years, because Spanish flu is still persisting as the common cold, what we are suffering from. Now, we cannot change what virus can do, but we can protect ourselves. So one of the most important component what is required in our fight against COVID, as you rightly pointed out, are the skilled manpower, doctors, nurses, and paramedics. Because beds do not treat patients. It is the people who treat patients. It is the doctors and nurses. So it is very, very important for us to concentrate on adequately staffing the Tier 2 and Tier 3 city government hospitals, public hospitals. I'll tell you why that is very important. First of all, when you drive away from any of the big cities, the biggest hospital you'll come across is the government hospital. The private hospital will have 20 bed, 30 bed. They can't make a big difference. So that is where our problem is. Strangely, today if you ask anybody, any senior doctor, any policymaker, any politician or a minister, how many doctors we have, nobody knows. How many specialists we have, nobody knows. The medical council will come up with a statement, we have over 11 lakh, 12 lakh doctors. But if you look at the list of the doctors, some of them were registered in 1930s, 1940s. Do you honestly think they are still alive or they are practicing? So essentially, first we need to get the data on how many real doctors are working in the country, how many nurses are working in the country. And nursing, the most important part of the fight against COVID are the nurses, almost as important as the doctors, because as doctors, we can manage 30, 40 bed ICU alone because we are just giving the instruction. But who is going to stand near the patient 24 hours, monitoring their parameters, giving them the oxygen, taking care of their needs? The nurses. They are the real fighters. So, and we have been having shortage of more than 2 million of them. So essentially, we need to relook at the medical education. We need to look at the numbers. We need to look at where do we have the maximum problem, and we have to staff it, because this COVID will not end by end of the year or 2 years. It is going to be there 4 or 5 years at least. It will not be as vicious and as contagious as it is today, but there will be some towns, some cities will have a spike, again it will go down. It is going to really stress the healthcare system. So we need to really relook at how the medical education runs, remove this thing about medical education being an elitist affair. It is like any other apprenticeship. We need to look at the nursing education. We need to create virtually every hospital with over 100 beds should become a nursing college. So if we adopt that attitude, believe me, we will be able to conquer, because people are going to get tested. Our victory is not in terms of reducing the infection. Our victory is in terms of when a patient unfortunately lands in the ICU, whether we can get them out successfully. In the end, that's what matters. In the end, what matters is how many people died due to COVID, not about how many people got infected with COVID.